And I have here rows and rows of stickers. These are for my pediatric patients. I usually give each of them a sticker after they did a good job. Hi, welcome back to my channel. My name is Dr. Christina Nguyen and I am a family medicine physician. I am also an entrepreneur and a mother. In this channel, I want to show you my experience and insights to help you be more successful and fulfilled in life. In today's episode, I want to take you behind the scene and share with you where I spend most of my day, which is my family medicine clinic. Are you ready? Let's begin. But before we get into the details, I want to highlight the comment of the week. If you want to be featured in my next video, leave a comment or take a screenshot and tag me on Instagram story or Facebook. So first, these are my 3 exam rooms that I see patients in, 1, 2, and 3. On top of each exam room, we'll have this coloring flag system to help communicate between me and my medical assistant about the order of the patient that I'll be seeing. So these are my labels that my medical assistant created for me. This is a way for us to communicate with one another so that we can provide the service to the patient efficiently and effectively. So this first label is recheck blood pressure. For example, if a patient comes in with blood pressure more than 130 over 80s, then I'll put this under the magnet and my medical assistant will know that she needs to check the patient's blood pressure again. When a patient comes into the clinic, they're usually running late or in a hurry, or they just feel very nervous to go to the doctor. The blood pressure and heart rate tend to be on the higher side, and that is called white coat hypertension, and we want to give them a fair chance before diagnosing them with having high blood pressure or hypertension. So we usually recheck the blood pressure, and more often than not, the blood pressure tends to normalize when we recheck them. And the next label that we use very often in my clinic is Spanish speaking. This to tell me that my patient is Spanish speaking and I will be needing an interpreter. And this is my interpreter. This is the MARTI system. It is a video interpreter system that connects to a real-life interpreter on the other end. And this system provides interpreter service to a lot of different languages. Here in our clinic, we see a lot of Spanish-speaking patients. There's also a lot of Arabic-speaking patients, Burmese-speaking patients, Vietnamese-speaking patients. For Vietnamese-speaking patients, since I can speak Vietnamese fluently, I usually don't have to use the MARTI system. But this is very handy. It allows me to communicate with my patient. And in a medical setting, we are usually discouraged from using family members or friends as interpreter for us. And I have a few other labels to help me communicate with my medical assistant, mainly for vaccination and blood test. Now, let's go inside the room. So we are inside my exam room. This is my computer where my medical assistant and I can use to access the patient's electronic medical records and updates all the information such as their demographic information, medical history, medication list, medication allergies, smoking history, and things like that. So earlier we entered the room from the doctors and the staff side. This is the door where the patient enters and exits. And this is the exam table where patients will be on during the physical examination process. As you can see, we have this paper here used for hygiene purposes. For each patient, we will roll out and we'll have a new fresh sheet of paper for the next patient. On the side of the exam table, we have this lever here that can be used to increase or decrease the incline of the exam table. Sometimes we have patients with back pain or neck pain or who are pregnant, who can't lay flat. This lever comes in very handy. And on the side of the table, we have these drawers that have medical gowns that a patient can wear when they come in for physical examination. or a certain exam that require some part of their body to be exposed. And in this drawer in the front, we'll have these speculum, these vaginal plastic speculum that we use to do pelvic exam and pap smear with. So we just look at our exam table. Next part is my tools and equipment on the wall. Let's start from this side. We'll have these glove boxes. We have this tissue box because sometimes when patient comes in, they will share with us some stories and they'll become emotional. These tissue box become very handy. Up here is a sharp safety box in which we put all our sharps equipment like the needles or the scalpel after we use them. On this side, we'll have a blood pressure cuff and blood pressure machines, or a fancy word for it is the sphygmomanometer. We have different size cuff to accommodate different size of our patients. This is the blood pressure bulb, and this is the lock that we use. And this is an otoscope. I use this to look into my patient's ears, to check for ear infection, to check for any cerumen impaction, things like that. And we use these speculum here to insert onto the tip for each patient. And we have different sizes. The smallest one is for newborn and infant and babies, and adults, usually we use the biggest size. And these are disposable, and the main purpose is for personal hygiene. So the next tool that I use every day is this ophthalmoscope. We can use this to look for the red reflex in babies' eyes, and in adults, I use this lights to check the pupils to make sure that it is reactive to light and is equal. On this side of the room, we have our sink. We have a hand sanitizer. On the sink, we have hand soap. So either way is an acceptable way to clean our hands. Either using the hand sanitizer, you just need to rub it on your hands until all the alcohol is dried off, or you can use the soap with the water as regular. And in this drawer, I have other equipment such as cotton ball. I have tongue depressor to help me look into the back of the patient's throat. I have Q-tip, I have bandages and alcohol wipes, and this is my iodine swab that I use to prepare patient's skin before I do a minor procedure such as removing the toenail or removing a mole or do a skin biopsy. This is a monofilament tool that I use to check for neuropathy in my patients who have diabetes. So this is my exam room. This is where I spend most of my time during my normal hour for clinic days. And this is my computer station. I have this handy stool that I stand on so that I can be in the same level with the computer because I am not very tall and because I don't want to sit on a chair. I just feel that standing make me work a little bit faster. That's just my personal preference. And I have here rows and rows of stickers. These are for my pediatric patients. I usually give each of them a sticker after they did a good job. They usually have shots, so I tend to give them a sticker after they're done, just to make them feel better. This is my inbox and outbox. It contains the faxes, the paperwork that need to be signed or reviewed or scanned. And my medical assistant helped me a lot with this pile of paper. And as you can see, things can build up very quickly. In addition to the sphygmomanometer that I show you on the board inside my exam room, we also have these portable sphygmomanometer with a cuff attached to it. This is a functional unit. And this is a stethoscope that you tend to see people wear around their neck or put into their side pocket like this. Doctors and nurses and medical professionals use the stethoscope every single day. We use this to listen for the heart rate, the rhythm, listen to lung sounds, listen to bruise in their carotid arteries. So this is a very essential tool. The next machine I want to show you is an EKG machine. EKG stands for electrocardiogram, which measure the electrical activities of the heart. So this is my white coat. So I want to talk a little bit about the white coat. So when you walk into a hospital or a medical clinic setting, you're going to see some people wear a white coat that are around the waist, and then other people wear a coat that are longer. The length of the coat indicates the level of education. When I was a medical student, I was wearing a coat that is short and up to my waist. And by the time I graduate from medical school, I got upgraded into a longer coat. So usually on the left side of the white coat, you will see the name, the abbreviation of the title, and the specialty that the doctors specialize in. So in my case, you can see my name is Christina Nguyen with the initials MD, which stands for medical doctors, and family medicine, which is the specialty that I am in. You can sometimes see the initial DO, which stands for Doctor of Osteopathic Medicine. So hopefully this has shown you a little bit about medical clinic setting and some of the tools and the equipment that we have to help you be more familiarized with the medical clinic. And if you have any question or if you want to see anything in particular, make sure to comment below and let me know. If you like this video and think that it was helpful for you, click the red button to subscribe and the bell to get notified of my future video. Thank you so much for watching, and I will see you next time.